Pop quiz. A 45-year-old patient is admitted with jaundice, dark urine, and fatigue. Lab values show ALT 165, AST 140, total bilirubin 4.5, and albumin 2.8. Which nursing intervention is most appropriate based on these findings? A. Encourage high protein, high fat diet. What does that say? High fat diet, to promote healing. B, provide small frequent meals low in fat. C, increase physical activity to stimulate liver function. Or D, restrict fluid intake to prevent edema. What do you guys think? And guys, the correct answer is B, provide small frequent meals low in fat. So let's see what's going on with this patient. First of all, ALT and AST is elevated, so we know the liver's in trouble. Then we look at the total bilirubin. That's also elevated. So that's letting us know that bilirubin's not being metabolized correctly. Why? Because the liver's in trouble. And albumin is low. Remember, albumin is a type of protein. That's a portion of the blood that's a type of protein. When the albumin is low, you guys have to remember, albumin is what keeps the fluid in the blood vessels, right? So when the albumin's low, the fluid's like, woo, nothing's holding us back here. Let's go out to the tissues. And so that patient will be edematous or look swollen because all the fluid that's supposed to be in the vessels is out in the tissue. So when you guys are looking at these lab values, that's how you're supposed to be thinking about the pathology of what's happening here. So we know for sure liver's in trouble. So the question is, what would be most appropriate? And it's going to be small frequent meals, low fat diet. Why? We want to rest the liver. That liver's in trouble. We don't want it working too hard. So the reason it's low in fat is because fat is hard to metabolize for the liver. If the liver's in trouble, we're trying to rest it. A, encourage high protein. Well, I'm not mad at the high protein part because remember, the albumin, which is a type of protein, is low. But what makes this wrong is the high fat part. I say this all the time, guys, and this is how NCLEX will trick you. This is how these nursing questions will trick you. They'll give you a right answer, put a comma, and then everything after the comma is wrong. Guess what? If the whole thing is not correct, the whole thing is wrong. So A is wrong. Then we have C, increase physical activity to stimulate liver function. No, we're trying to rest the liver. The liver's in trouble. So that's false. And then D, restrict fluid intake to prevent edema. That's not going to prevent edema. The reason the patient has edema is because of low albumin level. We really don't restrict fluid intake unless the patient has something like CHF or some other condition where we would have to restrict the fluid intake. In this situation, it wouldn't help because, again, the reason that patient's edematous is not because they have too much fluid, it's because that albumin is low. So all the fluid supposed to be in the vessels has crept out into the tissue. So the only correct answer here is B.